Hi, I'm Danielle Matias, Prolotherapist at Caring Medical Florida, here with Coach White. Actually, we're going to talk about your case today.
Yeah, okay. So,
Tell me.
yeah, I'd love to tell you about it. So, I fell off the ladder back in 2020 during COVID and impinged some nerves and then ended up having to have surgery on my foot. I had 2 broken bones in my foot, and so I had 3 surgeries total, and at least 2 surgeries too many, I think, and for what I had. And so I ended up with some really bad nerve damage, real bad burning from my just above my ankle down all the way to all 5 toes.
Wow. And so you had no pain. You fell off this ladder.
I was in really good shape, I thought, for my age, and but the ladder came real. It wasn't any chance to respond, and I came down on my foot and then on my back. Thought I broke my back at first, but I realized most of my damage was from my knee down, from nerve damage and the broken foot.
And the broken foot. So the surgery, sometimes you have to have surgery to fix the broken foot, but this nerve damage really has gotten worse. It hasn't gotten better.
The nerve damage was there originally, and then the 3rd surgery that I had, I think, was just a bad surgery, and it really it caused even more damage to the nerve. There seemed to be some severing, and it went from bad to worse, really. After the 3rd surgery, I think I would have been in a lot better shape if I had had the 3rd surgery. And then, they basically told me there was no hope. I just had to, over time, hopefully the nerves would heal itself, and I just had to be patient. And so I did some research, and I came up with the Prolotherapy, the PIT, Peroneal Injection Therapy, which is dextrose. But I couldn't find any doctor that would do it for me. Most of the doctors didn't even know anything about it, or they at least said they didn't know anything about it. And the ones that would at least admit, and my wife can tell you, we went on this long journey for almost 2 years. I probably saw 7 or 8 different doctors. The only thing that they could offer was, like a steroid. It was a temporary block, and we went down that road, and it certainly helped a little bit, but it was very temporary. And so I finally found you guys, Caring Medical. Of course, we're on the East Coast. We're all the way in Vero Beach, Florida, so we're a long ways from here, but it's been worth the drive. It's about a 3.5-hour drive each time, and especially after the hurricane, it got a little bit longer because of the traffic. But so grateful to be here. I saw really good improvement. My 1st and 2nd. My 3rd one was kind of moderate improvement, but we tried something a little bit different. But I'm really encouraged by, I've come miles, really, from my first visit just before the hurricane to where I'm at right now. So.
Just to clarify too, we're talking about the peroneal nerve, which runs actually at the lateral kind of back side of the knee, and then branches as it goes down into the front of the shin and kind of around the calf. After all of this with surgery and you're suffering from this pain, how did you end up in our office?
I knew about the treatment, and it was a doctor in New Zealand that actually had come up with the treatment, and so I just started researched all about it, and then I started looking in Florida and looked all over Florida. Tried the East Coast first, couldn't find anybody on the East Coast, and then found you guys, and everyone that had the treatment was saying the same thing that I'd heard from people all over the world that had the treatment. So that's how I found you, really just online, and I was just so happy to find a place in Fort Myers. We were familiar with Fort Myers. We honeymooned in Sanibel, so let's go to Fort Myers. It was worth the drive.
And so today, we treated you today. This was your 4th treatment?
4th treatment.
4th treatment today. And we've been doing what we call neural prolotherapy, or you mentioned PIT, neurofascial prolotherapy, has a lot of different names,
right,
where we're actually injecting non-inflammatory dextrose solution around the nerve. So we're doing that with ultrasound, finding the nerve, and releasing it with the goal of regeneration. And a couple of things we've been taking pictures of your feet at every single visit. At your
Right,
first visit,
right.
your feet were cold. You could even see like skin discolorations, differences in skin. It almost
Right.
looked like if you put your feet side by side that they didn't belong to the same person.
Right.
Because they looked vastly different. As we're working on this goal, your skin is actually changing colors, your scars are less pronounced. We're actually seeing changes on the ultrasound. We're admittedly, we're not done. We're not where
Sure.
you want to be and meeting your goals, but we're actually showing signs and seeing signs that your nerves are regenerating, which is wonderful.
Yeah, everything that I read in my research and the process and the length of time has been happening exactly like the research. And then one of the things that I've mentioned a couple of times to my wife is I put my foot together and look, they're almost the same color now, which is
amazing.
very, 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 very encouraging, because to go from hearing that you may never be active again to now being have this hope that I could be completely healed. So.
And you are a very active person. We call you Coach White for a reason, right?
Super active. I was a NCAA Division I coach and
Yeah.
was in the middle of a 5-year contract and was felt like I had a lot of fuel left in the tank and we're ready to coach for at least 5 or 6 more years. So. And a runner on top of that. So I bought a pair of running shoes for after my surgery and they're still sitting in the closet. So.
All right, we gotta get you to open that box, get them back on.
Yep.
Well, thank you for taking the time for me to interview you.
Yeah.
And I look forward to keep working with you on this and get you better.
Yeah, and thank you for your expertise and for using that to hopefully give me some hope for the future.
Absolutely.
I appreciate it.
Absolutely.